Hi, myself Dr. Vivek Sasindran, and today we would be talking about Meniere's disease. In my previous videos, we have often referred to this condition, Meniere's disease. Now, just to recap, this is probably one of the most common causes for vertigo. When do you diagnose it as Meniere's disease? So, Meniere's disease usually has a combination of 4 symptoms. One is intractable vertigo, 2 associated hearing loss. So, during an attack of Meniere's disease, the patient will have a drop in the hearing levels in the affected ear. Third would be tinnitus. So, usually they will experience very irritating, abnormal sound during an attack of Meniere's disease in the affected ear. And fourth would be oral fullness, that is kind of a blocked sensation in the ear. And classically, in a classical scenario, you would see all these symptoms together during an attack, and these tend to settle down following the attack. Now, if you look at the natural course of Meniere's disease, now these patients usually are well and fine. They will have intervals where they don't have attacks, but during an attack, it's kind of very distressing. And now, how frequent or how frequently a patient gets an attack is something based on which we decide or plan our treatment protocols. Now, most of the times you can get to a diagnosis of Meniere's disease purely with a detailed history. Now, classically, the vertigo would last for somewhere between few minutes to few hours. Audiogram is all that we generally need to kind of confirm a diagnosis of Meniere's disease. And in 80% of the patients, medical management is something that would kind of benefit or bring about relief to the patient's symptom. However, these patients have to be instructed to maintain a chart or a diary so as they can kind of document as to how frequently they have symptoms. Now, this is important because when we kind of monitor the progress of the patient, so we need to have a clear-cut idea as to how many episodes the patient had or used to have prior to the initiation of treatment. So you can kind of get a comparison between the pre-treatment and the post-treatment symptomatic relief. Now, when it comes to medical treatment, it also involves certain lifestyle modifications. So these patients are kind of instructed to reduce on their salt intake, advised to reduce fluid intake. Now, apart from that, there are certain medications which help to reduce the formation of this endolymph. Now, generally, the belief when it comes to Meniere's disease is that there is a structure called as the endolymphatic sac which tends to get distended, and this is what actually kind of causes the symptoms of Meniere's. So if we could kind of reduce either the production, or if we could kind of increase the flow of this fluid that builds up inside the endolymphatic sac, probably the symptoms can be relieved. And this is exactly what we do with medical treatment. So we have certain medications like furosemide, for example, a diuretic. So that is something that is commonly used. Apart from that, the other commonly used drug is acetazolamide. So these are medications which kind of reduce the production or increase the secretion or try to drain away the fluid from the inner ear. Now, apart from this, we also use labyrinthine sedatives to treat these patients. Now, what one needs to understand is to monitor the progress. Now, if the patient's frequency of symptoms is more or less the same as what it was prior to treatment with medicines, you need to consider the next level of management. So you need to step up your treatment. And the next option that we have is trans-tympanic injection. That is, you could probably inject steroids into the ear through the tympanic membrane. So, in case the patient does not have symptomatic relief with medications, the next option that we have is trans-tympanic injection of certain medicines like gentamicin. Now, this is something called as a chemical labyrinthectomy or a chemical ablation. So, these medications are toxic to the inner ear hair cells, and they kind of damage these cells and kind of reduce the symptoms. However, can be a subset of patients who would not find benefit with medicines, who would have gone in for trans-tympanic injections and still symptoms persisting, and that is when the role of surgery comes in. And frankly speaking, the role of surgery in Meniere's disease is very limited, and it is only for a very small percentage of patients that we would actually consider surgical intervention. Now, so the type of surgeries that you would decide or select for a patient is based on multiple factors: the age of the patient, the predominant symptoms, the hearing levels of the patient, and so on. And this is something that I would discuss in detail in my subsequent videos. Thank you so much.